Hi, I'm your host, Marsha Florence for Just Ask Podcast Live and Just Ask Talk Show. Thank you, ladies and gentlemen, for tuning in. Now, as usual, when you see us, that means that we have somebody in our studio audience great for you to hear from, or I'm doing a Marsha's recap. Today, we have with us Dr. Fayron Epps, who is going to tell us about the program Alter. So, ladies and gentlemen, without further ado, let me introduce you to Dr. Fayron Epps. Hey, Dr. Epps.
Hello, hello. Good afternoon.
Thank you for joining me.
Yes, no problem. Thank you for having me.
Now, Dr. Epps, you know what? I'm going to be honest with you. We know a little bit about the Alter program, but I want to start off with you. So can you tell us a little bit about yourself and your involvement with Alter?
Sure. So, as mentioned earlier, Dr. Fayron Epps, I've been a nurse for over 20 years. My PhD is in nursing. I'm professor endowed chair of caregiving research at UT Health San Antonio. Even though I'm in San Antonio, my work is across the nation, across the country. We are helping out families that are faced with dementia. I did my undergrad at Tuskegee University, got my PhD at Southern, and throughout my schooling, what was really instilled in me is using my education to make my family, to make my communities better so we can have better health outcomes.
Okay.
And so, one of the programs that I want to share with you all today is Alter, where we predominantly partner with Black faith communities across the country so we can do just that to make our communities better, especially those families that are experiencing dementia, have been impacted by dementia. We want to make sure that our churches, our places of worship have the resources, they have the knowledge, they're equipped to better support those families.
Okay. Well said. Now, you know what, Dr. Epps, I know that you've traveled here to Michigan, to Detroit. So tell us a little bit, what is the mission basically for you to gather all these different organizations to come and understand that there is programs within the church that support the families who are having loved ones with dementia? What's the mission?
So, our mission is to make sure that our churches have these resources. Many times, our church has been that go-to place, the Black church, I should say, have been that go-to place for so many things, but dementia just wasn't it, because in the Black community, we don't speak about it. Or we don't know too much about it, but it's really attacking our communities, y'all. We're twice more likely than our white counterparts to be diagnosed or experience signs and symptoms of dementia. And many times these families, they want to go to church, but they stop going to church because they think the church doesn't understand. My church family wouldn't understand what's going through, what I'm going through. They'll judge me. And so we're making sure we put resources in place so these families can come back. Making sure that a quiet room is there, worship service is shortened, deacons, ushers are trained. There's support groups, memory cafes, respite. We have a framework that we introduce to our churches, and we make sure we coach them so they can put things in place for these families. And we're looking forward to being able to do this in Detroit and across Michigan.
Okay. Okay, and that's a wonderful concept because, we all know that once upon a time, the church was the most powerful thing that we had, so where everybody went to get support for the family or to ask, the pastors, what should we do, to build something, whatever. And to me, personally, once they had started designing nursing homes and assisted living programs, families had gotten away from the church and started relying on having their loved ones placed in facilities that they feel like are the premier caregivers. So are we asking or saying to people, across the board, let's not necessarily reinvent the wheel, but let's restructure our church programs and bring back the communities to understand that the church provides a resource and a network to help you with your loved one?
Yeah, I think we can say something like that. Maybe restructuring or just providing more resources to the church so the families will know that, hey, if I need respite, I can call my church and they can help. They may have an adult day program. They may
Mm-hmm.
offer respite scholarships. So
Mm-hmm.
these are the things we're really trying to fill in that gap that exists in so many Black communities, with resources, with also healthcare access, even screenings. And so we work with our faith communities and the local partners. So we partner with organizations and connect them with our churches so we can make sure that we are filling in that gap. And so we will
Okay.
see different outcomes. One of the statistics is by 2030, nearly 40% of individuals that will be diagnosed with Alzheimer's disease or a form of dementia will be Black or Latino. That's less than
Wow.
6 years away. So
Okay.
that's why I feel that there's an urgency to this. I call it a public health crisis, and I
Mm-hmm.
am calling on our faith communities. I'm calling on our churches. I'm calling on our faith leaders. I'm calling on our community.
I
Y'all, we have to step up.
Look, they're going to hear you today, okay?
Are they
They're
not
going to
here?
hear. Well, that's wonderful. That's wonderful. But can you describe the onboard processing for a church to partner with Alter?
Yes, yes. So we have informational sessions that we do every third Thursday, 6 p.m. Eastern Time online, and we provide information. And if you're interested, we will forward an application to you. You complete that application, we will respond within 7 days and provide you additional information and set up a meeting so we can really fully discuss because the framework is tailored to your faith community. It can be an online ministry, you can have a small church, you can have a mega
Okay.
church. We are here for you. And we
Okay.
tailor that, and then we welcome you. We do a launch to the community, to your congregation, so they'll know what to start expecting over a 2 year period. Adrian Jones is one of our staff members, our liaisons that work
Mm-hmm.
very closely with our churches in Michigan to make sure that they have everything that they need, along with the public health department and some other local
Okay.
partners that we have.
I know I have a flyer here that I want to share with our viewers about Ultra information. Okay, so if people are interested, now I know this was, I said meetings are held on third Thursdays of each month. Now, can the different communities or different states also log on to this meeting, or was this just in your area?
Oh no, this is for everyone. So most definitely everybody in Michigan, I need y'all to log on that's interested in learning more. But again, like I said, we work with faith communities across the country. We're currently in 18 states. We already have some faith communities in
Mhm.
Detroit. And so I got to do a shout out for them for joining this movement and recognizing how important this
Okay.
is.
Okay. So you have some of us in Detroit already.
Yes,
Anybody we
I
know?
do.
Okay.
Let's see. I'm gonna do a shout out to Oak Grove AME, New
Okay.
Calvary Baptist. We also have Hartford Memorial Baptist and
Mhm.
El Bethel Baptist. So those are the four churches. They heard about us and they said yes. It,
Okay.
it,
Okay. Well, those some of our well-known churches now, so people will recognize Oak Grove and Hartford. So that's wonderful, and we hope that many more will help jump on board and start to work with you guys to increase our awareness and resources that are available through Alter and other programs. Because basically, what we're saying is that that the caregiver is the person who's trying to find services and resources, but they're slipping too. A caregiver can pass before the actual person who's ill passes because they're stressed out, not having knowledge, not having resources, and overwhelmed. And looking at a program such as yours, as Alter, will give people some resources to check into, especially if they know they can go to the church and say, you know what, I need some resources. Pastor, can you give me some guidance? And that's a wonderful thing. I wanted to bring up a couple of photos because I do have some where there's a gathering. So can you tell us a little bit about gatherings like this? I mean, these people look like they're kind of happy here. So is this one of your courses or classes that's being taught or
yeah.
something?
Well, partnering with us, we come out, we do education and workshops. And the picture that you're probably showing is the picture from our summit, our inaugural Ultra Dementia Summit, where we brought faith communities from all over. It was 325 attendance by 325 individuals, faith leaders, caregivers, persons living with dementia to come learn on what they can do, what they can take back. Because some people
Okay.
may not be ready to partner with us and do a full-fledged program. But if they can learn one thing that they can do, that helps out families. That's just one thing. And so that's what that was. That was in Atlanta, Georgia, at
Okay.
House of Hope with Pastor Dewey Smith, E. Dewey Smith. And it was a family reunion. So I look forward to you all joining us next year. We're going to do it again in April 2025. And we welcome you to Atlanta to come and learn more on
Okay.
what you can do.
Well, I tell you, I had to bring up all these photos because I wanted our viewers to see how well put together this event was. And so people will know that you guys are on the rise and, let's get it here in Michigan as well. Now, your logo here that says caregiving while Black. Okay, that's a beautiful logo, very beautiful logo. So I had to bring that up as well so we can see that. And coming back to you, I just wanted to thank you for all that. That resource is very helpful to us so people can see that, hey, I need to join the bandwagon on this program here. Okay.
Yes.
Okay.
Can I share a little bit about caregiving while Black? Because as we work with our faith communities, as a nurse scientist,
Mm-hmm.
I introduce research opportunities. I introduce new programs, and Caregiving While Black is a program that was birthed from the community, from my work in the churches, hearing from families, expressing that their experiences are a little different, a little unique because of the color of their skin,
Yeah.
and they wanted a resource that can actually respond to that, that can address that. And that's what Caregiving While Black is. It's a for us, by us program.
Right.
Right now, it's part of a study for us to really show the evidence of how it impacts the emotional well-being and the mastery of caregivers. But I
Okay.
just wanted to put that out there. And these are the programs that we kind of introduce to our community and to our churches. And I want for all our listeners to know that we hear you.
Mm-hmm.
And
Mm-hmm.
my goal and my team, our goal is to make sure we create programs that can respond to the needs. And we come out a lot and we're listening because we want to make sure that there's more quality of life while people are on this journey and
Mm-hmm.
that we can change health outcomes.
So, Dr. Epps, what has been one of the greatest challenges that you have encountered in spreading this program? What is the greatest challenge?
I would say I have two. So one of the greatest challenges was early on was getting people to understand what we were trying to do. Again, because no one really spoke about this in the Black community, when I would go to alliance meetings, speak with leaders, they were very leery, like, what is dementia? What is
Mm-hmm.
this? What you want
Mm-hmm.
us to do? And so it took me, not just me, my team, for us to be persistent and for us not to take no for an answer because we knew the urgency, we knew those statistics. And so we just had to make sure that we kept showing up at the meetings and being able to share. Now we fast forward 5 years, fast forward, now our biggest challenge is we don't have the capacity. we it's a small team and we're all over and we're traveling and we are building up our volunteers. So shout out to our volunteers for the altar program because without them, along with my team, there's no way we'll be able to be in 90 plus faith communities.
Correct. Yeah.
Yes.
But you know what? I mean, you're good. So, in the past interviews, we've heard you say altar is your ministry. When did you realize that this was your purpose?
I would say 4 years ago.
Just four
So
years ago? You sound like
yeah,
a lifetime. Okay. So
yeah, no, that's
what was going on 4 years ago that brought you to the forefront today?
well, when I first started this, I was called in my pastor's office. So Bishop Allen in Fayetteville, Georgia, wanted me to do some type of ministry in church. And I had all these excuses, like so many people do. And when we started talking about what do I love to do, he said, form your ministry. And I just did it just to do it. It was nothing. I didn't know it was going to grow. I didn't know anything was going to come out of it. And I would say about a year after that, or a year and a half, when I seen the impact that it was having and how many people was reaching, and I felt different as a person. So as I was developing this with my team, I was growing spiritually. And
Okay.
I also see members of my team grow, and it hit me like, oh, this is what it feels like to be walking in your purpose.
Mhm.
This is my
Mhm.
ministry. This has taken over my life, and I love every minute of it, because I am a nurse, and I may not do nursing and direct care in the hospital, but I'm caring for the community. And that's
Correct.
how I look at this. And I thank God every day, for showing me this and leading, ordering my steps, and having me to be able to use my education and my experience as
Mhm.
being a nurse for 20 plus years and bringing this to the table and to help out.
Well,
Um,
I must admit, I mean, you're doing a wonderful job. I mean, I welcome you to the Just Ask Talk Show family. So I appreciate you being here with me today. And I'm hoping that with our viewers, we get the word out and the pastors, come on board. We want more pastors to come on board. So this is a great opportunity. And like you said, when you have your passion and your calling comes on you. Sometimes you ignore it, like, I'm too busy, not right now. But then all of a sudden, it hits you like a freight train, and you realize that this is your calling, this is your passion. So let me go ahead and put forth the effort and get it on board. And if you've done this in 4 years and gotten thus far, you've done a great opportunity. And I know that's God telling you, this is what He wants you to do. So that's a wonderful thing. I just want to say that here in Michigan, more or less, the idea of people having dementia, whatever race it is, we still are separated, unfortunately, when we come to resource tables, and it's unfortunate. So, like you said, within the Black community, we're lacking education or resources because we don't know which way to go and what direction to go in. And I believe that if we can implement a program such as Alter back into our businesses, such as the church, then the congregation will let the pastors know, yes, I've suffered in silence. Yes, my family has dwindled down and it's only me as the caregiver and I need some support. What can I do? Who can I turn to? This is important, and this is a very important time for people to recognize that we can rebuild the strength and the structure of the church to be one of our founders, to make sure that we get what we need instead of just waiting for television or waiting for somebody to say, are you aware of this program? Did you hear about this? A lot of stuff is word of mouth. I'll admit to that. And just as we try
mhm.
to capture the audience that doesn't have the brochures, the papers coming in the mail, somebody stopping by the house. So we try to cover every aspect with getting words out, such as your program. And I am very honored to have you join me, truly. So I wanted to get that out, about that. And I did have a couple of questions about your. In addition to the summit, Alter partners with Sage Navigators Incorporated and the Rosalind Carter Institute on Caregiving. Describe Alter's role with that partnership.
Oh, that's just examples of partners, how we establish partners with organizations and nonprofits, for us to have a greater reach and to bring more resources into the Black community. So, if we look at the Rosalind Carter Institute for Caregivers, they have several programs that they do. And we are working with them to make sure that their programs, such as dealing with dementia, gets into the Black community. So, we help them
Okay.
update one of their workshops, their manuals, so it can be more reflective of the Black community, has some spiritual quotes in there, inspirational quotes, I should say, just from us, because we know what we need to hear sometimes when we're on this journey. And so
Mm-hmm.
that's an example of the partnerships, but it's many more. Sage Navigator, Us Against Alzheimer's, Alzheimer's Association. These are the partners that we are working with to make sure that our churches get these resources.
Okay. 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 And what kind of advice would you recommend to a family who sees signs of dementia? What would you advise them?
Yeah, so I think the first thing is to go to your provider, because if you see signs and symptoms of dementia, it may not be dementia. It could be several other health
Mm-hmm.
conditions. So it's
Mm-hmm.
so important for you to go to your provider, share the signs and symptoms. If you've taken the notes, I always say bring a notebook so they can see what you've been seeing. And then they should run these tests. So they would do lab tests to make sure it's not a vitamin deficiency or thyroid problems, urinary tract infections.
Right.
other
Right.
things like that that can mimic the signs and symptoms of
Mm,
dementia, but also they can do a memory screening. And if they see that that memory screening warrants a further follow-up, then they can refer you to a neurologist or a geriatrician or someone
mm-hmm.
that can give you these tests to really dig deep in to see if this is truly a form of dementia. There's over 100 types of dementia. And so many people just think Alzheimer's disease, but there's so many types. So this is nothing, a diagnosis that can happen overnight.
Correct.
But one of the main things is if you notice these signs and symptoms, please don't push them off. Follow up with your provider, be persistent. We have to advocate
Mm-hmm.
for ourselves, for our loved ones, because we know many times we can be dismissed when we bring our concerns to our healthcare provider.
Mm-hmm.
And so if you don't like what you're hearing, you don't get responses, go to the next one.
Right.
We have to be persistent and advocate for ourselves.
You know, a lot of
And
people look at their insurance. They're like, "Well, I don't have a certain type of insurance. They may not. They may not." You don't know, ladies and gentlemen, until you actually go to the doctor. Okay, so I frown on people saying, "I don't know. I don't have no insurance." You have insurance. If you got Medicare, Medicaid, Blue Cross Blue Shield, Aetna, Humana, whatever, you have some coverage. You can still get checked out, and that's the main thing. And like you said, some of these other conditions mimic signs of dementia, and people don't realize that. Especially a UTI, a urinary tract infection, it definitely does a number on a person until you actually go in and find out that there's something else going on, dehydration causing some issues and stuff like that. But a lot of times people think that when you get a certain age, you don't require a lot of care. I'm kind of dismissed with that. I mean, whatever age you are, you need care, okay? Whether it's dental, vision, hearing, or full body checkup, just to make sure that you don't have anything. My concern is that people have insurance and don't utilize the insurance. I don't understand how we can go a whole year without going to the doctor and never getting checked out. But one thing I want to say and piggyback on what you were saying about going to the doctor, if you are a caregiver of a person or if you're the adult child, I always say go to the doctor with your loved one and go in the exam room so you can hear what the doctor says and firsthand. Because if my parents go into the doctor's room and then I say, "What he say?" and they say, "He said I'm okay." Okay, or I'm all right. You don't really know. You don't really know. So how would you get the knowledge if you're not in the exam room with the patient to find out what really is going on? Or if you have the privilege to ask the doctor, "May I have access to my mother's information?" Because the patient has to agree to allow that person to come in or to allow that person to receive information about their care if they want them to know or not.
yeah, and I would
That's
say
another issue.
Yeah, I will say this. So when we're dealing with dementia families, things can be a little complicated,
Mhm.
right? Because many individuals don't want their family members to know that they have signs and symptoms or
Mhm.
they're in denial. So that family member, that spouse, that partner, you're going to have to be a little bit creative to communicate with the healthcare provider. And that
Mhm.
may be bringing in a letter, writing a note, and slipping it in when you register at the front desk. Yeah, I just want y'all to think about these things. And as you say, us not going to the doctor, I don't want us to fuss. I want to give you a one tip. Plan to go to the doctor. So, like we write in everything else in our calendar, write this in because it's so, so important, especially our caregivers. Many times, our caregivers end up passing away before the person that they were caring for
Correct.
because they wrote all of their appointments in, their loved ones' appointments in, but they didn't write their appointments in.
Mhm.
And so, it is so important. If you have insurance, if you don't, there's so many programs that are out there for us to just get ourselves checked out. So
Yeah.
I just want to make sure we share some tips, that you can kind of think about. But again, if you're caring for someone with dementia, I know it's not easy. And I know you have to think outside the box sometimes to get the care that you need, to get the resources, because it can be difficult, especially if somebody's in the early stages.
Correct. Correct. Now, I mean, before I tie up, Dr. Epps, this has been a wonderful segment. So I hope that you will join me again. But what is your vision for Alter?
My vision for Alter is that we will have faith communities that we partner with in all states across the country, but also internationally as well. So we will be in all the places wherever people come to worship. And not just in the Black community. I'm looking forward to being able to expand and to go into other communities. We're working to go into the Latinx community as well. We want to make sure that all faith communities are equipped and they can be recognized as dementia-friendly congregations.
Okay, okay, that would well said, well said. Well, I'm hoping that you will come back and join us again because, there are going to be some questions about what you do and what's the connection with the Detroit churches here. So, on that note, the people who are in that congregation of the churches that you mentioned in Michigan, can they start to utilize the service now, or is it just, initial program platform? So, what can they do now?
So right now, I think it's just recognizing that your church has signed on, and so give them a few months because you're going to start seeing programs that they will implement. Because what we
Okay.
do is we're training our churches, we're training our leaders to implement and put things in place. And
Okay.
we were at those four churches. We'll be doing some launch meetings, so I'll be there in person or maybe through Zoom to announce this partnership. And again, just stay tuned. You'll start seeing them incorporate programs that
Okay.
you and your family can benefit from.
Okay. Well, I really hate to run, but Dr. Epps, would you come back and join me again?
Of course, of course.
Okay. Don't be a stranger. I enjoyed this very much, and I'm sure that our leaders in the churches will appreciate this opportunity to learn more about Altar as well as our communities. So hold that thought for me now. I'll be right back.
Sorry about that. No, I've been staying at my dad's place because of everything.
Here you go. It's your favorite. It's chicken noodle.
He's good.
Oh, wait, Dad. Wait, hang on.
Yeah, I know, we keep missing each other. I've been working out of my dad's house, doing some reading. I should be working out more. I know it's important to stay healthy. It's just, I don't have the time. I just feel like I'm drowning.
Your turn.
In tough times like this, we know it can be easy to neglect your own health and well-being.
Dad, it's the girls. Oh.
What kind of dance is
But
that?
while you care for your loved one, you also need to care for yourself.
You look good.
Go to aarp.org/caregiving for free mental health and self-help tips.
Well, ladies and gentlemen, you know how we do here at Just Ask. I mean, we try to give you everything that you need to make sure that you are educated in resources and information about different services that are available throughout the state of Michigan and beyond. So we definitely want to thank Dr. Epps for her services today, her information. Look at the television screen, PBS Channel 56. Catch this show and many more on our several cable stations, YouTube, Facebook, and our website. Well, with all that being said, you know who I am, and what do I always say? If you have a question about a person with a disability or just a general question, don't be afraid to ask, just ask. See you next time.